This hospital has been around longer than most. Started back hundreds of years ago, actually. Most people don't know that as the Boston Dispensary. Sam Adams, Paul Revere, the American patriots here in Boston started it. And it grew over time. Some people don't realize there are actually two separate but very related hospitals, the Tufts Medical Center itself, and then the floating hospital for children here at Tufts Medical Center. We actually work pretty closely with our colleagues in pediatrics when it's appropriate. So, people can come here and their entire families can get care on the adult side, the pediatric side. Tufts Medical Center is the primary teaching hospital for Tufts University School of Medicine and has been for quite some time, and it's a wonderful relationship. Over the past few years, with the name change here from New England Medical Center to Tufts Medical Center, that was done in part to signify the very close relationship we have with the school. Although we're an academic medical center, I know to some patients that might mean they come in here and they're taken care of by interns and residents, and the senior staff clinicians might drop by every now and then to check in. Well, that's maybe that's how things worked at some places years ago, but it's certainly not the case here. The attending physician or the staff physician or the senior physician, who is the one really dealing directly with the patient and most responsible, feels that sense of responsibility not only to the patient and their family, but to the patient's physician outside of our medical center. So I'm the one, if I'm taking care of that patient, I'm the one talking to them and their family about the big decisions, and I'm the one talking to their physician at home about what happens and what we recommend. You always think, what if I was the patient? What would I want my experience to be? How can we ease their journey, through our center with scheduling testing, pleasant people over the phone, good people with great attitudes that they're seeing when they arrive for their visit, always ready to help. If someone looks lost in the hallways here, there's always many people who come up to them, can I help you? There's really a lot of training that goes on here to make sure everyone has that same spirit of, let's help patients get through this and have, the best experience that they can here. I would say that Tufts Medical Center would be defined as a place with world-class specialists, world-class care for patients, having everything you would want in an academic medical center with a lot of high-level services, but perhaps much more accessible for patients than many larger academic centers. So, you get the depth and the breadth of what you want, in care and specialists and generalists, in a more accessible atmosphere and perhaps a more intimate atmosphere for patients and their families.